Hello, everyone. I hope you all are having a great day. My name is Shataya Williams, and I'm the Outreach Coordinator with Moms in Motion. And I welcome you to another episode of Voices in Motion, where we highlight community partners making an impact across Virginia. Today, we're excited to welcome Children's Trust, and they are an incredible organization working to strengthen families through advocacy, education, and support. So, joining us today, we have Jeanette Craighead, who will be sharing more about one of their programs called Healthy Families Roanoke Valley, Virginia. I'm super excited to introduce her. She is the Director of Preventions at Children's Trust. She brings over 15 years of experience in mental health, probation, and family support services. She is passionate about early intervention and advocacy, and she now leads key programs like Healthy Families, Children First, and CASA, which all focus on strengthening families and preventing child abuse. With a strong background in therapeutic and justice involved settings, she is dedicated to building safer, more nurturing communities for children and families across our region. So, thank you again for joining us today.
Thank you so much for having me. Again, my name is Jeanette Craighead, and I'm the Director of Prevention here at Children's Trust. Just wanted to give you guys just a little snippet of what we do here at Children's Trust and our program, specifically Healthy Families. It's a home visiting program. We can take parents who literally find out, you know, in the bathroom that they are pregnant, and they decide that they need the support. And we are here to do that for you guys that are in the process of the motherhood or parenthood journeys. So we can take a family as soon as they find out they're pregnant or up until the child is 3 months old. If there is any DSS involvement, we can take the families up until the child is 24 months. So there is a nice little break, a little gap in that age. So our regular criteria would be 3 months, but if DSS is involved in any capacity, then we can take the child up to 24 months. And like I said, it's a home visiting program, and we have someone to come out and just get to know you, know your story, and learn more about you. And then that resource specialist will come back and talk to the home visitors and myself, and then a home visitor will be assigned to that family, and then they go out and meet with the family and then start the home visits. Typically the home visits are once a week for the first 6 months. Doesn't have to be the first 6 months, just depends on how quickly the families progress in the program. And after that, they'll move up to a level 2, which is every 2 weeks. And then after that, as they continue to progress in the program, they'll go to level 3, which is once a month. And we stay with the families until the child is 3 years old, if the family chooses to, and then they would graduate from the program. We do different screenings with the families, depression screenings, early intervention screenings, domestic violence screenings, and we get them to the resources that they need while they're with us in this program. So we're really in there with the families and become, part of the family, really, and watch the child grow and help you all with any needs that you have and supports that you all may need. We work with them, the families, to make sure the child is meeting their milestones, work on different activities. So if let's say there's a delay in some fine motor skills, then they'll do different activities to help the child meet those milestones and gain those motor skills that they need. And to support the moms and dads that, that might be a little frightening if there's a delay, or just in general, parenthood is hard. So anytime that we can be of support to the families, then that's what we do. So it's really easy to get into the program. If I can pull this up, I can show you all. So with our Healthy Families, if you go to our website and you go to our different programs, It tells you who our family support specialists are. We have two right now. Those are our home visitors, Christy and Allison. And then our um, resource specialist is Vanessa Morea, and she's the one that will come out and meet with the families ahead of time and get to know them. And then there's a screening tool. Hopefully it pops up. And you can just put all of your information here on this form, and then it comes straight to our email. And Vanessa would reach out to you all and schedule a time to come out and meet with you and get to know you. There's no documentation requirements, nothing really. We don't ask for anything. No, there's nothing. If the child, if their parent is a teenager that's under the age of 18, then what we would ask is that the parent or caregiver would have to sign consent for the pregnant teenager and to join the program and to continue on in that program. But like I say, it's very easy to do. It's very easy to enroll. And then we just go from there and meet with the families and provide support. And some of the questions on our screening tool, if you don't know or anything like that, it's not a big deal, because once Vanessa comes out to meet with you, then we learn all the things that we need to learn anyway. So we don't need to have, if there's some things that you just don't know, or if you're referring someone else and you just don't know those questions, those answers to those questions, then you can just say unknown and we'll figure it out when we get there. Does anyone have any questions so far? I can't hear you.
Can you hear me now?
Yes.
Okay, awesome. So what happens at a home visit?
At a home visit, usually the home visitor will get updates with the families, find out what's going on, and then provide an activity for the family, for the child to do, depending on the age. And then, like I say, they also do screenings. They do cheers check-ins. So they just observe the parent interaction with the child, so they can know what to look forward to and how to plan for their next home visits.
Okay, awesome.
Yeah. So the visits can last from 25 minutes to an hour, sometimes longer if need be. If a parent is in crisis when a home visitor arrives, that crisis becomes the first thing that we address. We're not going to pull out an activity if a parent is in crisis. We're going to address that crisis and make sure the family gets what they need to get. Any resources that are available in the community, we make sure that they get that.
Okay. And in terms of resources, so how do you all ensure that the program is accessible and culturally responsive for,
So
diverse families?
right. So once we find out what the needs are, then we have different community partners that we work with, and then we provide a referral out to those resources, and let the community partner know what's needed, and how it's needed, and if they can accommodate, then they can get that done.
Awesome. Let's see. And I guess a follow-up question that I do have is, do your resources typically have a waiting list?
Some do, but most do not. And if they do, some of them will go pretty quickly. I know, like with CHIP, as far as their services, I know that they do have a wait list. But our services, in comparison to CHIP, we're a little more intensive with our home visits, because we see the families more often than CHIP does.
Right.
However, if a family has CHIP, we can still be in the home and still do home visits. We don't require any insurance, no payment. This is a free voluntary service. So if Chip is in the home, they can still do Healthy Families because there's no overlap in services.
Okay. And so, how may a home visit differ from, I guess, because you mentioned if the child has some type of, delay,
Mhm.
how might a home visit differ from resources to, I guess, frequency?
So with our any delays that we have a
Mhm,
curriculum that we use called Growing Great Kids,
mhm,
and it just helps with supporting the families and making sure that they get the resources that they need. So if we, let's say, have to do a referral to early intervention, then we would accommodate, we would adjust our activities based on the delays in order to try to work with the whatever interventions that are being done. We would work
mhm.
with them to make sure that we're doing everything in compliance with what they have going on with that agency.
Okay, nice. I don't see any additional questions from our end right now, but of course, if I have any, I will ask them.
Okay.
And I have listed you all's the Healthy Family website link in the chat. So, can you share any success stories or testimonials from a family that you've worked with?
Sure. So we had a family actually in December of last year that graduated. Um, our home visitor was assigned to that family. Um, the mom had gone through a trying time of domestic violence and and abuse. And so her child was removed. And then she was able to advocate, get her child back. And he had various delays to the point that doctors were like, he probably won't talk, he won't walk, he won't really be able
Mhm,
to do any of the things. And she was going to be his permanent caregiver. Um,
mhm,
Mom advocated for him, and then our home visitor was there every week until she finally moved in through the program into the different levels. But our home
mhm.
visitor was in there every week, and when mom would get upset about something, our home visitor would encourage her, like, this is what you need to do, this is how you need to handle it. You need to advocate for your child. Getting upset is not going to fix it. You have to advocate for your
Right.
child, and supported her while she advocated for him. And they finally graduated the program in December. He was 3 years old,
Mhm,
and he was doing all the things that doctors said he was not going to be allowed to do or able to do. He can probably outrun me. I would go and shadow. So when our home visitors go to the visits, I will occasionally shadow them just because I also
mhm.
want to get to know the families. Um,
Right.
so when I would go visit with this family as well, he would run around and play and do all the things that doctors were like, he's probably never going to be able to do. And so that family still keeps up with our home visitor and checks in, even though they've graduated from the program.
Mhm,
And it was just a huge success. Mom went back to school. She got away from the violent situation that she was in, and she's doing amazing and raising him, and having the supports and figuring out the supports that she needed. We got her linked with what she needed as far as resources in the community, and she now can advocate for her son on her own and get the resources and maintain those relationships to make sure he gets the medical attention he needs. Like, it's a great little family. um, and so we miss them in the program, but it's nice every
mhm.
once in a while to get those updates that they're still doing great.
Right.
Yeah.
That's amazing.
Yeah.
So we do have a question from Octavia. She
Okay.
says, once needs are authorized, how often does the individual have to get authorized to continue services?
Once they're in the program, that's it.
Mm.
If so, anytime if they're pregnant, they can come into the program up until or after birth, then we can take them up until the child is 3 months old. And once they're in the program, then they're in it. They just have to continue with and consistently meet with the home visitor in order to maintain that status until the child is 3 years old. So there's
Oh,
no like annual review or anything like that. They're just in the program until they graduate or till they no longer want to be in the program.
okay. And then you did say that you all meet with your participants monthly.
Once they get to level 3, it's monthly.
Mhm. Okay,
Initially,
okay.
it starts out at level 1, and that's weekly.
Hmm.
And then it'll go to biweekly and then monthly.
Got you. Okay. So, what type of training or tools do staff members or the volunteers have to get to work with the families?
So they go through different core trainings with Healthy Families America.
Hmm.
Since it's a nationally known and evidence based program that we do. So they go through all the training with Healthy Families America. And they also go through growing great kids. They're trained in that curriculum and how to do because there's so many different activities and modules that are associated with this
Hmm.
curriculum. So they're trained in all of that.
Okay. And the Growing Great Kids is specifically for families, well, special need families or families whose children have disabilities.
It's just a general curriculum, and then we adjust as needed.
Oh, okay.
Mhm.
I like that. I love that your volunteers have training because I know a lot of families that we work with sometimes they're hesitant about meeting frequency and who's
Mhm.
coming into their home. So it's good to know that everyone that you all work with and that is going into the home has trainings.
Yes. Yeah, they have no problem, like, and we get it that things happen, you can't always meet
Mhm.
every week. So
Right.
we try to reschedule and work around people's schedule as much as possible, without putting our staff out of the way, and also not putting the families out of the way, and making
Hmm.
sure that we can try to meet with them as much as we can.
Yeah.
um, yeah, and if it doesn't work, then it just doesn't work, and we try it again the following week and see what happens.
Right. Have to
Yeah,
keep
and
trying until you get there.
right, there's no penalty. We get it, and sometimes some of our families, they start working, which is what we want.
Mhm.
And so if their work schedule gets a little hectic, then we kind of figure out how to work around their work schedules and make it work to accommodate them.
Right. So, I guess if, say, for instance, you can't meet with the family and they are level one, if you can't meet with them weekly, are they penalized for that, or do you guys just keep trying until you
We
can meet
just
with
keep
them?
trying. Our goal, if they can't meet it, like, within a month, if they can't meet four
Mhm.
times, our goal is that they would at least meet 3 times.
Right.
And that doesn't always happen, and it's okay. And that's the thing about Healthy Families, like, we just keep going until we can figure it out and make it work. But that is the ultimate goal, is to meet at least a minimum of 3 times a month,
Mhm.
if they are on level 1.
Okay. Oh, and then Octavia, Octavia, excuse me, also asked, um, is volunteer training currently open?
To be a home visitor or to join and be enrolled in the program?
I believe she might be typing.
Okay. Because our home visitors are not volunteers.
Mm,
They are the full-time employed staff. Yeah.
okay. Yep, she said home visit.
Okay. Yeah, those are full-time employees. They're not
Mhm.
volunteers. Yeah.
Okay. Thank you for clarifying.
Mhm.
Okay. And let's see. So it sounds like the program is really beneficial, especially for families of all ages. I guess, is there a difference in if a participant is a teen mom? Because I know you spoke on that a little earlier in your presentation.
There's no difference. If
Okay.
if we have a teen mom, we just have to have
Hmm.
parental consent for them to participate in the program. But after they turn 18, then they can sign their own consent forms and their
Hmm.
own um, documents or whatever. If they're involved with DSS, then they can sign their own release of information. But the program is still the same no matter what. We just adjust to um, the different levels of the parents as needed.
Hmm.
Yeah.
So from teen moms to regular parents, and then to individuals aging out or just leaving the program, what would you say the long-term benefits of healthy families is?
I feel like my personal opinion, the long term
Hmm.
benefits is a lot of the families that we get have endured some kind of trauma or abuse or emotional distress growing up,
Hmm.
and so our ultimate goal is to help cut those cycles, those patterns of abuse,
Hmm.
and make sure that these families know that there's resources out there and that being a parent is not easy. It doesn't matter your economic status. It does None of that matters. It's hard to be a parent.
Right.
So just being able to know that there's resources out there and how to tap into those resources to help them to be better parents, so the babies can have happy, healthy lives is the ultimate goal. And I think that's the long-term benefit, is that we provide a sense of happy, healthy families.
Yes, that's super important. And just so everyone who has joined us late, can you review one more time how they can sign up or refer someone to the program?
Yes. So if they go onto our website, our Children's Trust website,
Mhm.
scroll back up here, and if they go into programs, and they can go on to Healthy Families Roanoke Valley. And once you
Mhm.
click on that, if you scroll down just a little bit and then you hover over this Healthy Families um, America, that will give you the Healthy Families America site as well. But then right below it, it says to access Healthy Families screening tool. Click here. And once you click on that, then you can answer all the questions and fill in the information, and it'll come directly to our email. And then someone will reach out and schedule a time to meet and get to know you better. And then once we do that, then we'll go from there and assign a home visitor to the family.
Awesome. Thank you so much.
No problem.
And lastly, do you all have any volunteer opportunities or events coming up in the community that you would like to share?
We do. We have typically in April is our
Mhm.
biggest volunteer and events of the year, but we will be having a fundraiser called Golden Halo. It's where we recognize various community partners, and for all the work that they do to help us with our mission in the community. Um, that's going to be our next biggest thing. And then
Mhm.
as we get closer to other events, we're still in planning phases on most of them. I can send you that information to get out.
Awesome. Thank you so much.
Yeah.
So I guess if anyone would like to volunteer, your biggest event will be next April,
Mhm.
and
Yeah.
then you all can learn more information then.
Yeah, and we are always looking for volunteers for our CASA program.
Yeah.
Um, That one you have to be at least 25 to be a volunteer. But there's a let me find it on here too. If you go back to our programs page and our our court appointed special advocates, there's a volunteer form that you can complete as well if you want to volunteer to be a CASA advocate. And those are for the kids that are in the foster care system. And so our CASA workers are amazing volunteers, and they get in there and they visit with the families as well, and they get to know the kids, and they kind of help become the voice of the child that's in foster care. So that's always a good opportunity at any time. Our next class, when we do our training for CASA volunteers, will be in September. So if you want
Okay.
to join that, click on that link and fill that out, and we'll get you interviewed and get you set up to be a CASA volunteer.
Yes, and then also we are happy to share if you guys have a flyer for that as well,
Okay.
just so anyone who wants to volunteer doesn't miss it.
Okay. Sounds good.
Awesome. So thank you so much for joining us today and for walking us through how to apply and refer individuals for a Healthy Families Roanoke. It was a pleasure speaking with you. And if for our audience, if you or anyone that you know is interested or is in need of these services, feel free to click the links that we dropped in the chat, or you can also call them and email them. And I will also drop their email list. Sorry, their email. You can email them at info@roact.org. And thank you all for tuning in for Voices in Motion. And until next time,
Thank you.
thank you.